Persistent depressive disorder by Nico Taylor. Persistent depressive disorder is a chronic type of depression in which persons' mood are regularly low. The symptoms are not as severe as major depression. The exact cause of persistent depressive disorder is unknown. It tends to run in families and occurs more often in women. Most people with persistent depressive disorder will also have episodes of major depression at some point in their lives. Older people with persistent depressive disorder often have difficulty caring for themselves, isolation, or medical illness. The main symptoms of persistent depressive disorder is a low, dark, or sad mood on most days for at least 2 years. In children and teens, the mood can be irritable instead of depressed and lasts for at least 1 year. In addition, 2 or more following symptoms present in most of all time: feelings of hopelessness, too little or too much sleep, low energy or fatigue, low self-esteem, poor appetite, or overeating. People with persistent depressive disorder will often take a negative or discouraging view of themselves, their future, other people, and life events. Problems are often seen as hard to solve by these individuals who experience these symptoms. While this disorder may not be as severe as many other depressive disorders, persistent depressive disorder affects approximately 1.5% of the adult population in the United States. Getting tested for this disorder, your healthcare provider will take a history of your mood and other mental health symptoms into consideration. The provider may also check your blood and urine to rule out medical causes for this type of depression. People with this disorder may also be helped by some type of talk therapy. Talk therapy is a good place to talk about feelings and thoughts and to learn ways how to deal with them. It can also help individuals to understand how persistent depressive disorder has affected their life and cope with it more effectively. Cognitive therapy, which helps to learn and be more aware of the symptoms and what makes them worse. This will allow individuals to have a solid thought process regarding their problem-solving skills. Insight-oriented can also help persons with persistent depressive disorder understand factors that might be behind their depression and depressed feelings. Persistent depressive disorder is a chronic condition that can last for many years. Many individuals never fully recover, while others continue to have some symptoms even with treatment. This disorder may also increase the risk of suicide. Individuals should consult a healthcare provider if they're regularly feeling low or depressed and these symptoms are getting worse. Persistent disorder can be a disorder that stays with individuals for a very long time, so early detection and treatment is adamant if this depression is to be reduced.